Thank you.
Oh, of course. Yeah, no, I agree. I feel like I've been using it as it's like a story almost. I don't know. You just start like at any point in the story and then just try to figure out how you get to the end. Um, yeah, it's just like these long pathways are just it's a lot. It's a lot of stuff to remember, especially the freaking ventricles. Oh my god, the names of those things are insane. It sucks when you can't pronounce anything. That's the that's what I don't like about it. Um, cool. Should we go on to number or letter C?
Yes.
Oh yeah. Okay, so that's Broca's area, right? And that's on the left. So we left common carotid, and then left internal, and then that's also middle cerebral.
Could it be anterior cerebral or no? Because actually I'm not sure.
I think that the you're right. It's an associated area to the motor strip.
Your cerebral, but that's where I'm not sure.
I know that, what is it? Hold on, let me go back to it. So yeah, if it goes to left BA45, that means it's going to the frontal lobe, the motor area. So that means that we're primarily focusing on the left side motor area. So it basically has to connect up to there.
I think those are separate. So I think like the Brodmann area 44 and 45, or yeah, 45 is like separate from the left internal capsule. Like he's saying, like from the left common carotid artery to the left internal, and then another problem is from the left common carotid to the left primary motor.
Hey, do you guys have a leader?
Not yet. We're still figuring this
You
out.
need a leader. Just a suggestion. If you get your leader and have the leader share the screen of the emerging document, I don't know. For me, it works better because I'm a very visual person, but however it works for you, but just a suggestion. Okay.
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 Thank you.
But are you doing okay?
Yeah, we're trying to figure it out.
Okay.
We're a little confused on the left internal capsule part.
Oh, are you on the first part, the A?
Yeah,
Yeah.
we're on A.
Okay. Well, what do you have?
So I guess our
I'm visual. I need a picture. I need a picture.
oh well, we haven't we're only brainstorming. We haven't.
Oh, you're
written it.
brainstorming. Okay.
Yeah, because
Oh,
we're not sure if we're wrong or right, because we were confused about the left internal capsule, and
okay.
I know that the the left common carotid artery would be the second branch.
Okay.
So after that there'd be a third branch, but we're not going to count that. But there's an internal and external carotid.
Yeah, that is true. So you're going to go from the left common carotid to the left internal carotid. Forget the external. Just the blood. Just think about a molecule of blood. A blood cell. Where's it going to flow? It's going to go right past the external carotid. So just leave it off.
Okay.
It's going to go from the left common carotid to the left internal carotid to the what?
Is it the middle cerebral artery?
Right. Yes. Then to the what?
The
That's
anterior cerebral artery.
Right. No, it's not the anterior cerebral. Yeah. Well, what artery this? So we're talking about this artery. It's a really important one for SLPs. Basically, it provides blood to the entire side of the cerebrum. And all this deep stuff, including the internal capsule. Do you know what artery I'm talking about?
Is it the MCA?
Mm-hmm. Right. Yeah, and then to the internal capsule itself are actually branches off of the MCA. So once you get that, that's it.
Okay.
So you don't need to describe the entire anatomy of everything. That's why I say leave external carotids off, because the blood that goes through that is not going to end up in the internal capsule.
Professor, I was going off of slide 38 where you had that image. Like I was trying to follow it.
Is it the
through there.
lenticulostriate arteries? I'm not sure what 38 is, but
Oh, the chordae,
are you looking at it right now?
Yeah.
Can you share it?
Oh, sure. Yeah,
Okay.
let me try. So it's this one. I was going off of
Oh, which one is 38?
this one.
Okay.
I was like, cause in your lecture you said
Oh,
that
this is the one. Isn't this the one that we're leaving off though for this time?
well, it's said 30 to 38.
Yeah, I said, I think it was like 3 slides and I said, just forget about them. So let's don't do them now.
Oh, so don't.
But yeah, because this is within that little list of 3 slides, I think, that has to do with the principles of contralateral and ipsilateral control. No, don't go there. We'll do that next week. We'll pick that up. We're not forgetting about it. Really important, but it's so important and kind of conceptually a little tricky to grasp. It's not hard. It'll be okay, but I just didn't want to rush through it. Basically.
Do you mean we'll pick it up tomorrow or?
No. Next week.
Oh, so it's not going to be part of our exam.
No, didn't you get my little message?
Oh, I guess not.
Yeah, it was one of my, you always read my announcements because I put forget those 3 slides.
Oh, okay.
Yeah, I didn't put them in the test. And I said the reason was because as I started to write the test, I realized those are too important to rush over tomorrow, and I didn't want to do it. I mean, they are in the recorded lecture. They are there. But when I got to writing the test, I said, for right now, just put that aside. We'll deal with it next week, a week from now.
Okay, so when we're doing like the flow diagram for like the left internal capsule, like what's a good picture to go off of? Because I remember in the lecture you circled over here that the internal capsule is over here.
Well,
so
that does show the internal capsule, but let me bring my. Why don't you keep working on things, and I'll bring my screen up here, but it'll take me a minute.
Okay.
Okay. Yeah. And then I'll come right back.
Okay, thank you. Yeah, I just think I get lost whenever I'm trying to think of a diagram. There's just so many diagrams that I'm like, which one should I focus on, or like which one's the most helpful?
Right. Yeah, I gotcha. Well, right now we're just talking about blood flow, so it's going to be a blood flow diagram, or it's going to be a anatomical illustration of blood, and I'll go to the one that I think helps you to think about it the best.
Okay, please, that'll be the most helpful.
Which is what I'm doing here.
Thank you.
I'm just not quite ready to share a screen. Are you guys there?
Yes.
I don't hear anything. What are you doing?
Oh no, we're here. I was confused. I thought you were sharing a screen or something.
Well, I am, but use this time because. Oh.
Yeah, I think we're reading off our notes, just looking through for like the
Gotcha.
process.
Okay,
Yeah.
well let me go ahead and share a screen here now because I do have a screen, and let's see. Okay, do have a screen. Oh, I'm view. Let's see. Hey, Crystal, can you take your screen away? Because I don't think I can share as long as you're showing.
Yeah. So I just like pause. I'll stop.
Yeah, just stop sharing. Yeah, and then I can
Okay.
share a screen. Okay. And here's my screen, I think. Yeah. Okay, so this is the middle cerebral artery, and two things I want to show. It supplies blood to basically the entire side of the cerebrum, including all the language areas. So anterior language area, posterior language area, Heschel's gyrus, the motor and sensory homunculus, but not for the entire body, just basically for the upper part of the body, not the lower extremities. And then the next screen I'm going to share is this one. Okay, this is the middle cerebral artery. Let me enlarge it so I can use actually a pointer here. Okay, so this is the middle cerebral artery branching off of the internal carotid. So down here would be the internal carotid. This is the anterior carotid. It's not a good image of it, but there it is. And then here is a good image of the base of the middle cerebral, and you can see that it goes out and it divides out and supplies blood to the most of the side of the cerebrum. But importantly, for our question here, which is part A, the lenticulostriate arteries branch off of it and provide blood to the internal capsule. There it is. That's the internal capsule.
Oh, okay.
Yeah. So MCA, lenticulostriate arteries, internal capsule.
Okay, that makes sense.
Are you with me?
Yes.
Okay, I'm going to stop sharing and I'm going to move on to another group then.
Okay, thank you for helping.
Okay, make sure you're writing down and you have somebody designated.
Okay.
Okay, we need a leader.
We'll get one.
Okay, bye.
Bye.
How are you guys doing?
We've been just trying to take it like one by one with each question. We just barely finished.
Okay, so you got A, B, and C done?
No, just A.
Okay, and do you have a leader and do you have a list? Or, I mean, do you have it in writing?
Yeah.
Okay, perfect. Okay, good.
I got it.
Okay, who's your leader?
Me, Grace.
Okay, Grace, great. I'll write that down. I'll randomly choose. But you've got A done and you're going on to B? Hello?
Yeah, we're just
Okay.
gonna try and just see how much we can get done.
Okay, all right. Thank you.
You're welcome.
Bye.
What I can, oh, I guess we're gonna go.
Well, I was just coming to see how you're doing. I'm taking a little longer than 15 minutes because people aren't quite done. So how you guys doing?
I'm gonna be honest with you. This section, I just can't grasp it. I just cannot grasp it.
Oh, okay. And does that go for all of you?
Yes.
Okay, let me give you a clue then, and let me just take 1A. So what you want to do is you start with a starting point and then the end point, and then think what is the immediate blood supply for the end point? Well, we know the starting point. It's the left common carotid. Okay, so in your list, you're going to go left common carotid, then comes something else. But down at the bottom, and I think there are only 4 or maybe 5, something like that. is going to be the left internal capsule. What arteries supply the blood to the left internal carotid? Excuse me, to the left internal capsule.
Is it the middle?
Well, yes, it is the middle cerebral artery. So, but then there's the branches off the middle cerebral that actually provide the blood to the internal capsule.
Are you thinking of the left lateral ventriculostriate arteries?
That's right. Yes. So it's going to go. Left internal carotid. Something else. Left middle cerebral artery. Left lenticulostriate arteries. Left internal carotid. So there's just one other thing in there. It's the number.
Because what I have is I have the left common carotid, left internal carotid.
Yep, there you go.
And that goes directly to the middle cerebral.
Mhm.
And
Left,
then
always put the left laterality.
Oh, I said the left middle cerebral
Okay.
artery. And
Mhm.
left. Then I put because I just blew up like slide 36. I said left horizontal segment artery, and then I have.
I don't know what that is.
Well, that's part where it's just before the lateral lenticulostriate arteries, according to your diagram that you gave us.
Okay, could you share that screen and just show me, because I just print. Okay, I'm guessing that's a part of the middle cerebral artery, and
yeah, because it shows right here where it comes off the middle cerebral artery, and then it points to horizontal segment MCA.
Okay.
And then above that is your lateral lenticulostriate artery. So that one.
Okay, let me share a screen.
Because I print, what I do is I blew up your PowerPoint diagrams so I can see them clearly, and then I printed them and I start writing on it. I usually don't type all that stuff up, but I want to see it. I'm a visual learner, so that's how I do it.
Okay, I'm gonna. Do you see my
right?
diagram? Yeah.
Yes.
And so here's the internal carotid.
Mhm.
Here's the middle cerebral, and I'm just guessing that this is horizontal segment. Oh, I see it.
Well, maybe it's pointing at the other piece.
Okay.
Is this considered the middle cerebral? But see it. I'm confused by it.
I never paid attention to that, but it makes sense. I mean, it is horizontal.
Right, because see how it goes to the cortical segment.
Right.
And then it goes, because actually I added, for some of the other questions, I added that piece.
Well, that's a level of detail. You're going actually more.
I know I'm probably overkill, but I figure it's best just to go as far as you can.
It's fine, but I never paid attention to that before, or noticed it, frankly.
Well, because you said some of the the terminus of some of them.
Yeah.
Like you go Brockman's area 45, and then you have the left primary motor area, and then you have arteries that go through the insula that go to the outside. Mm-hmm. And so I figure you have to label each one in turn.
Well, I mean it's fine to do it. It's just.
I'm just going. I know I'm probably overkilling it, but that's how I think.
That's perfectly fine.
Okay.
That's perfectly fine. But yes, you have the list. That's it.
Okay.
So you're ready for B.
Wait, what was the list? What was the list? Please go back and say it again.
Yeah, I know. I digressed, everybody. I'm sorry.
Okay. Is somebody writing it down?
I'm trying. You guys keep saying all these things.
Okay, whoever is writing it down for the group, share your screen with each other.
Yeah, because I said I wasn't going to write it. I'm just saying.
Yeah, just make it visual so you all see the same thing. You're like a committee, and you're deciding on this list of 5 things, which is like the sequence of where it goes. Okay. And Georgina, you asked, does that make sense? Just think about the starting point, which I give you here in the question. Okay, and then think about the ending point and what artery that we have studied provides blood to that area, and then what's in between. Okay. And for all of our systems, it's only going to be, I don't know, 2 or 3 other arteries in between.
So with the first one, then the left lateral lenticulostriate should be the end point, right? For the first one, for 1A.
Well, yeah, actually, I mean, you could say the internal capsule. But yes, that is.
Well, is it the internal capsule just a group of the axons? Just a white matter?
It's white matter.
Okay, so that wouldn't be blood vessels. Right?
That's true. That's true.
Okay, it would just be like a telephone cable with lots of wires, right?
Correct. That's it.
Okay.
Exactly what it is. Okay, I think you've got the point. Georgina, are you okay? You're holding your head.
Actually, I have a question. It doesn't.
Well, okay, yeah, but let me just address Georgina for just 1 second, and then Daniel, then you can ask your question. So you're thinking about what things the blood goes through that we have studied, and in this particular example, it goes through the left common carotid artery. Then the blood goes to the left internal carotid artery. Okay, then the blood goes through the left middle cerebral artery. Because remember, we're just getting it to this one thing. So we don't have to think about all those other things. Like, forget the external carotid artery. It has nothing to do with what we're talking about. It is true that the common carotid divides into the internal and the external carotid arteries, but we're just trying to get blood to the internal capsule. External carotid artery does not take blood to the internal capsule. So you're going to just forget it. So it's left common carotid, left internal carotid, left middle cerebral, left lenticulostriate arteries, and you're there. Here they are, and here's the internal capsule. Is that working for you, Georgina? Okay, good.
I was completely lost. Like I was.
Yes, you know, the thing about this is studying. So
I think what's hard is that it's not as to see the lenticulostriate artery is not very apparent from the slides. The only way you can really see that is if you blow them up on your own.
But it's apparent here, isn't it?
Well, it is the thing is, it depends on what you're doing. Some people won't see that as clearly as
right.
True.
Right.
You won't know that you need to go through that to get to what you need.
Right, because I
picture.
I couldn't, from my perspective, I couldn't see it, and so I ended up blowing up everything so I can see everything.
But now you do.
And then that's how I approached the problem.
But now you do see it.
Yes.
Yeah, that's what we're doing. So we're just forcing you to think in a way which is going to allow you to solve clinical problems. For sure.
So for B, we're trying to get to Brodmann area 4.
Oh, for B.
Yeah, are we trying to get to Brodmann area 4?
Yeah, we're trying to get to the motor strip, but we're trying to get to the part of the motor strip that controls the face.
And so that's going to be the lateral aspect of
the lateral,
right?
Yeah, because you look at that motor homunculus and you see part of it dips down. I mean, this is not a picture of the homunculus, but part of it dips down in here in the mid-sagittal fissure, the lower extremities down here, but the face is out here. Now, what artery is providing blood to the face? Hint, hint. Huh?
So all we would say in that regard, to make it simple.
Nobody answered my question. Maybe you did, but I didn't.
I would say just if you're going to be real basic, we just say middle cerebral artery.
Yeah, that's it.
That's it, right?
Yeah, because we're not going into the branches of the tree. I mean,
yeah, because that's what I did.
They are labeled,
but if that's all we need to know is just middle cerebral artery.
Well, pretty much it's out here.
Okay.
You know, just go at this level. In other words.
Okay. That's fine. We don't have to be that granular on this, right?
Yeah. Don't go any. You can go more detailed if you want to, but I don't expect you to.
Yeah.
Go more detailed than what we have out here in the slides.
I guess remember very detail oriented. So
I did mention sometimes some of the figures here, the illustrations will have labels that I never refer to out here. And so I'm not expecting you to necessarily learn.
But you did refer to the lenticulostriate artery, but it's not mentioned directly.
It's not here, but it is.
Right. But you did mention it that we should know it though.
But it is in another slide.
Oh, it is.
Oh, for sure.
Okay, I didn't see it. That's
well, at least I think it is.
So, but I figure if you're going to go to something that's mentioned in the diagram, I figure everything is fair game after that.
But yeah, no, there's. I don't know about this. Well, like for example, this thing, horizontal segment. I mean, I didn't even really know that
Right, I understand. Okay,
Yeah.
I'm just trying to figure out what level of detail
just
that we
what's-
need to know.
Well, here's your anatomically somewhat correct illustration of it.
Right.
But
I'm just
out
going for
here-
what the tools they give
out
us.
here's what we're focusing on.
Okay.
Yeah. Okay. Danya, you had a question.
I think it was kind of answered. I was just gonna ask if we have to go through the anterior communicating artery or no.
Not for anything here in A, B, or C.
Okay, yeah. So I think
Now, I'll tell you how I might think of a question to make you go through the and in like a question like this. Let's say your patient has a total blockage of the right internal carotid artery, yet they have not had a stroke ever. Can you tell me how blood gets to the right Brodmann's area 44, 45? In order to accomplish that, you're going to have to get some blood through that anterior communicating artery. That's where the circle of Willis comes into play in that case. For most of us, most of the time, we've got functioning carotids and vertebrals. Nothing goes through our anterior carotid. It's open, but as we age, it actually starts to close up. And some people are born with just a ligament there. They don't even have a functioning artery at all. But most people have one. But nevertheless, blood's not really going through it if everything else is working. Does that make sense? It's like a kind of a, it's like it's a fallback. It's a fallback system in case something else is blocked.
is this like the hydrocephalus thing that we covered or no? Is that different? No, okay.
That's a ventricular system.
Right.
For cerebrospinal fluid, that's separate.
Yeah, and the circle of Willis is a anatomical protection against the possibility that one of your four main arteries that supply blood to the brain get blocked. That potentially you can still have circulation to all parts of the brain. Mm-hmm.
Professor,
Yes, Jasmine.
I think we can all agree this is a lot of information for us to take in.
That's true.
Just chapter 3, even though that's not just the chapter we're being tested on. Can you please tell me and us, is this exam going to be like clinical implication heavy? Are you going to be asking a lot of?
Listen, why don't I answer that question with everybody here?
Okay.
Okay, so save that. And I'm going to go ahead and close out the rooms because we've had more than 15 minutes.
Okay.
We'll go through these problems and then you're going to then ask me that, okay? Right away. Don't jump in. Don't forget. I know you won't forget.
I'll jump.
Okay, great. Okay, so I'm going to close the rooms right now. Okay. Okay, hello. We went more than 15 minutes, obviously. Yeah, so, it seemed like most of you need a little more time. Let's just go through each of them. And can anyone volunteer for A?
Professor, did you want me to save my question for after we go?
Yeah, just right after, Jasmine.
Okay.
Yeah.
Okay.
We'll stay focused here. Yeah, don't. And can anyone volunteer to show us a list or share your list for A? And you all seem to be on the same wavelength now that it's 1, 2, 3, 4. By the way, when you're working together, you were all talking about it, obviously, but sometimes you weren't sharing a list. And I think this is really visual. And just as a learning strategy, make it visual. So when you're talking about this, get the list out in front of you and decide what's the next thing on the list, and that's going to turn it visual. Okay, any volunteers? Okay, well, let's just take group 3. I don't know who group 3 is, but I'm picking a number randomly. Who's the leader for group 3?
I was in group 3 and our leader was Evan.
Sorry, I thought we were group 2. I apologize.
Okay, Evan.
Great. Do you mind if I just share my screen?
Yes, please.
Oh, well, let me make sure I have a screen to share. There we go.
Okay.
Cool. So we had the first one, which is the left internal capsule.
Okay.
And so where we're starting is the left common carotid artery.
Okay.
And then we'll go into the left internal, so the internal branch of the common carotid artery, not the external.
Okay, and you're absolutely right. Just be, complete. So you'd say the left internal carotid artery.
The left internal common carotid artery.
No, not the left internal. No, just the name of it is the left internal carotid artery.
Left internal carotid artery. Okay, perfect.
Okay.
Oh,
there you go.
Artery. And then we'd go. We get to we're in the left internal carotid artery, and then that also creates the middle, or once we get into the brain, we have the middle cerebral artery that branches off the left internal carotid artery.
And again, I'm gonna just be a stickler.
Mm-hmm.
Include the laterality of everything.
Okay.
Yeah.
So left middle cerebral.
Because when we get into clinical things, sometimes you're going to have the damage on one side and the signs and symptoms on the other. So we're just going to be in the habit of always including laterality on everything that we say, unless there is no laterality, like confusion. There's no laterality on confusion. So confusion is confusion.
For sure.
Yeah.
Okay. Then I'll add this real quick too.
Okay.
So we're in the left middle cerebral artery, and then we follow that deep into the brain. And it reaches the internal capsule via the left internal capsule via the left lenticulostriad artery.
Yeah, okay. And then just on that D, the last D, it's TE.
Oh, there you go. Thank you.
There you go. Okay.
Perfect.
Okay, great. You've got it. And then you've got the left internal capsule.
Yeah.
Very good. You guys did great. Can we just go through it with you guys, because you are right. Your list is very clear here.
For sure. So then the left primary motor area for the face we start at the left common carotid artery.
Okay.
Then the left internal carotid artery.
Okay.
And then that follows up to the middle cerebral artery.
Which side?
The left. Oh.
Okay. Okay, good.
Well, actually, we had a question about that, because if the motor is going to decussate to the right, on your left side, would we not put right middle cerebral artery, or would this not be a right pathway? I don't know if that makes sense.
Oh yeah, I understand what you're saying, and I think it's also an illustration of why we're always going to include the side of everything, unless there is no side to it. But yeah, what you are talking about the decussation of that system, and it does decussate. But the question didn't ask anything about the signs and symptoms. See, if you're talking about signs and symptoms, then you have to think about that. But this just asks you to get that blood to the left primary motor area for control of the face. So it's the left side of the brain. So, and that's what you've done. You've gotten into the left side of the brain, a certain area there.
Cool. Perfect.
Yeah, it is.
Thank you. And then, and so then we have Brodmann areas 45. So we start at the left common carotid, then the left internal carotid artery, and then that branches off into the middle cerebral, and the middle cerebral supplies blood to BA 45.
Yep, that's it. Very, very good. Very good. Very nice list. And very clear. Thank you very much. Okay, before we move on to, Jasmine has a question, but before we move on to Jasmine's question, does anyone have any comments or questions about what we just did? Additions, amplifications, clarifications, or questions about it, or points of confusion or anything? Oh, Grace.
Yeah, I just have a quick question. So for the first one, underneath the left internal capsule, they mentioned like left lenticulostriate artery.
Yeah.
And I was kind of like asking that in the chat, just like asking like what slide that was mentioned on.
Oh. Okay.
And they said it was on a diagram on slide 36, but it wasn't one that you like verbally like mentioned. And so I don't know like how specific.
Let me share a screen on that, because I with subgroup, that slide did come up, and here it is. And so this is the diagram that most clearly shows the lenticulostriate arteries branching off the base of the middle cerebral artery. Is that
okay?
Grace, do you think that's what you're referring to?
Yeah.
And
I think
and then here's the internal capsule right here. Here's the thalamus. Here's the lateral ventricle. Here's the thalamus, internal capsule, basal ganglia. And then you can see that middle cerebral artery continues on out to the lateral, to the side of the cerebrum, basically, and provides blood to most of the side of the cerebrum, including most of the motor homunculus and most of the sensory homunculus. The part of the two homunculi, motor and sensory, that don't get blood from that MCA are down in here in the mid-sagittal fissure, and that is provided with blood for both of those homunculi, motor and sensory, by the anterior cerebral artery.
Okay.
Okay. And Mark was asking about branches and stuff earlier. We're not studying any of the branches. We could, but we're just not. And clinically, it doesn't seem to matter. Here's the deal on strokes. You can have a blockage down here in the neck of the MCA, oh, excuse me, not the MCA, the internal carotid artery, or even the common carotid, right where they bifurcate is usually where those blockages develop. And you can have a massive stroke of the entire territory of the MCA, or you can have just a part of it. It sort of depends upon the metabolism. In other words, these blockages, when they happen, and I'm kind of jumping ahead, but I'm just trying to tell you why we don't have to focus on the details of all the names of all the branches. For this reason, you can have a big block down here in the neck, and you get the whole side of the cerebrum is wiped out. Or it could just be a little section. Even though the block is down here, it can be a little section up here, because what happens is the blockage is never 100% and permanent. It's always partial, and it sort of comes and goes a little bit. And so the part of your brain that happens to be consuming the most oxygen at the moment and is active will be the part that dies and becomes the stroke area. So you could have a massive lockdown here, and it only lasts 3 or 4 minutes, and then it kind of restores itself, not 100%, because we're talking about a disease situation. And then it kind of comes back enough that you restore enough of the blood flow, but you end up with a little stroke up here, someplace up here. Does that make sense what I'm saying? So it never gets down to, oh, it's this little branch here, and that's the bad branch. Am I making any sense?
Yeah, but should we still be aware of the lenticular striae?
Well, yes, the lenticular striae, yes, because this is hugely important, that internal capsule, and just to understand what's going through it. You kind of know what's going through it right now, but you'll learn, we'll be talking about the internal capsule quite a bit. And so it's very important to understand where it is, what it does, and how it gets its blood. Yeah, so mostly we're not, I think as far as the MCA goes, that's the only branches off the MCA we actually know a name for. And we're just, and as clinicians, we're just fine with that. Yeah, okay, Renate?
Oh, yeah.
Okay.
Could you go over the primary motor area for the control of the face?
Okay, sure. Let me show you the motor homunculus for that. And I don't remember exactly where that is, but I will find it pretty quick.
So is it always on the homunculus, or is there a place in our face where the trigeminal works from or something like that?
Hang on just a second. Let me find that homunculus.
Okay. Yeah, there it is.
Oh, do you see it?
Number 30. Or what?
Oh, 30. Yeah. Oh, I don't think so. No, it's not.
It's the one underneath, no?
Oh. Uh-oh. Is anyone else looking? Because okay, is it in chapter 3? Maybe it's not even in
homunculus.
Chapter 2.
Chapter 2. Okay, well let me go there.
That's right. Yeah, it's chapter 2.
Okay.
Figure 2-7.
Oh, okay, 7. Oh, okay, figure 2-7, yeah. But in the slides, I'm looking for it in the slides.
Oh yeah, in the slides.
So Dr. Kitzelman, for this particular lesson in chapter 3, we're just focusing on the middle arteries. Are we going to focus as well in the interior and the
Sure. Yeah, anterior cerebral. Yes, there will be things about the anterior. But as far as SLPs go, in terms of ranking the importance, I would say middle cerebral artery the most important, because it deals with the language areas and the speech areas, and then on the right side you get a minor hemisphere syndrome from strokes in the area of the MCA on the other side. And I'm still scrolling here, by the way. I'm just looking for the motor.
Slide 20.
Yeah, 20. I did find it. Okay, thanks. And then the second most important would be the posterior cerebral artery, because it deals with vision and that reading and even use of your visual field aside from reading, even to do anything visual. Like, tell me what this is. Here, what is that? You have to be able to see. So
well,
we're
the left eye is seeing, but the opposite field is blind. So
let's take that question separate.
I think we're just worrying about just blood flow right now.
Yeah.
Not about the contralateral aspects.
Let's do one at a time, and I'm going to do this one, and then I'm going to answer a question from Renate, and then we can do that one. Okay, so I'm going to share a slide here. Okay. So I'm stop sharing there and start sharing this one. Okay, and I'll enlarge it. And your question, what was the question on the homunculus?
What left primary motor area for control of the face? So I'm like, where is the motor area for control of the face?
Well, it is going to be in the precentral gyrus because that's for motor control. And then as far as what part of the precentral gyrus, this is a coronal section through the precentral gyrus. Well, I think this is motor down here. So precentral gyrus, this is postcentral gyrus, and you can see the homunculi are the same. But this is motor, so it's a coronal section right through the precentral gyrus, the motor strip, Brodmann's area 4. There's 3 names for it. And here's the face area out on the side.
Got it.
Yeah.
I didn't know that was the motor area for the face.
Well, the precentral gyrus is the motor. The precentral gyrus is the motor area for everything. And here's the face area out on the lateral convexity of the brain, cerebrum. Okay, so that takes care of that one. I'm going to stop sharing that.
Thank you.
And there was one other question, then we're going to go, I forgot what it's about, the visual field.
How does the blind, so the left.
Okay, well, let's see. I'll tell you what, we have to look at the image of that. And, but I'm going to ask, Jasmine first to ask a question because she has been waiting on a question for some time, and then we can look at that visual field.
Thank you, Professor. I was wondering, because this is a lot of information with all the chapters, chapter 3 being especially heavy.
It is.
Is the exam going to be very clinically application heavy? Because you said it was going to be like the quizzes, and the quiz questions have been more direct, straightforward. But then we get into these type of questions, which is more like lesion here, stroke here, damage here. If this happens here, what happens there? And I guess I just kind of want to know, like, what more is it going to be, if any?
Yeah, well, I mean, I haven't done a real careful analysis of the 50 questions that I wrote, but I have a strong sense that they are qualitatively really like the quiz questions. I mean, I don't think I actually used any quiz questions, but you may think I did because it may look exactly the same, except my choices are different or something like that. But no, I don't think it's any more clinically heavy. I mean, it's not clinically complex in my opinion, but there's some sort of clinical questions, but I think it's qualitatively really like the quiz questions.
Okay, because the questions from the quizzes and the questions that we go over that you have us answer are very different and more like the ones.
You mean what we're doing right now?
Yeah, these are more, I would say, complex than the questions you've given us in the quizzes. So I just want to say.
Absolutely, absolutely. But here's the deal. Right now, these are not really questions. These are like study techniques. That's the way I view what we're doing right now with the flow. These flow diagrams is, I mean, I could write a whole bunch of quiz questions that really don't ask anything about clinic. Like if I just say to you, the common carotid artery divides into 2. What are they? You know, that's what you're doing here. But I'm making you do it in a serial way. You know, like let's get the blood all the way up to a certain area of the brain. Let's not just get the blood from the common carotid to the internal carotid and the external carotid, but I'm asking you to think through the whole thing. So it's not really very clinical what we're doing right now. I don't see it that way.
Not right now. I would say not these particular questions, but questions we've done, like when you've broken us into groups before in previous classes.
Yeah.
This one is more like, if you just understand like kind of the gist of it, but like previous classes have been more like, if this were to happen, you have a patient that has this or something. And some professors are very clinically heavy in their questions for the exams.
Yeah, so. I think we'll get more clinically heavy, but right now,
I'm not there. That's why I was wondering.
Yeah, exactly.
I'm not there yet.
Yeah, right now we're just trying to get the blood up to the brain. So
I'm trying to get blood in my brain right now.
Yeah, we're trying to get the blood up.
Trying to get those synapses to work.
I'm trying to get those axons to
Yeah,
synapse.
we're trying to get some action potentials going, but we don't have quite enough to solve many clinical problems really yet.
I just want next time, can we do this like 3 days before the exam?
Well, I think I asked if you wanted to do it Sunday, but no,
I did Sunday. I
we
put
had
Sunday.
very low interest in Sunday. But yes. Yeah, it does seem like it'd be nicer to do it earlier, I think, Tuesday.
I just think it's a little, I guess in terms of the way that the lecture structure has been, because it's sort of, asynchronous in a lot of ways. And then we have sort of like a crash study, like an hour and a half before the quiz. I think it causes a lot of anxiety.
I agree.
Yeah.
Maybe
I've talked individually, different people have said different things. I'm kind of thinking that maybe, even though I kind of discourage this, but I don't have a strong opinion about it. Maybe I'm really wrong on it. Maybe we really should have the quiz about a subject we just finished the next week. And granted, you will have been studying something different during that week. Nevertheless, you will have had a week to go over the old stuff, however you choose to do it. So maybe that is better, and I'm perfectly fine.
Because it does take at least 3 days to develop any kind of long-term memory, correct? We're trying to do something within 24 hours, and I think that causes a lot of issues with people trying to retain the information.
Yeah.
Just adding the extra section.
What extra section?
The last section of chapter 3. It's a lot of information.
Well, it is a lot of information, but
what is included? Are we
3 weeks? So
are we going to include the all the cortical spinal tract, how it desiccates, and how we're?
No, those I sent an email to.
Yeah, I saw that, but I think some students are confused what was included. Maybe you can clarify that for us.
Well, I think I specifically said.
Yeah, I got the specificity,
the pages,
but I think some of our students don't get it.
I said the specific slides to forget about, and the specific pages of the text to forget about for right now. And then we will pick them up next week. I mean, I know they're in the lecture, but as far as your studying goes, forget those. I mean, I don't offhand, but I could go back and read the email.
Because that was about the axial. That's about the axial areas and the upper and lower extremities, how the desiccation, how those proportions work.
Oh, that was from earlier.
Right.
Excuse me.
I was wondering if that is included, because that was like, I think that's what Jasmine is referring to, that last section. It was very conceptual in nature. Try to grasp that.
What is that part of chapter 3?
Yes, it is. That's the last section that you have lectured on.
Well, let's look at. Let me look at the.
Because I think that's causing a lot of anxiety.
Oh, okay, gotcha. Yeah, let me look at the slides, and then the email, and let's just make sure we are all on the same page here. I don't know if you're seeing the slides. Probably not. Am I sharing any screen right now?
No.
Okay,
no.
Good. Okay, so yeah, let me find what we're omitting, and then you tell me if this is what you're referring to. Okay. Okay, so it starts on page slide 37, and I will share the screen here. Hang on. Yeah. Okay, so 37. Are you seeing that? Principles of contralateral and ipsilateral motor control?
So this slide is not included on the exam.
Correct.
Right? Okay.
Nor the next one.
Okay.
Nor the next one.
I think this is where a lot of the frustration has been coming on. Yeah, I agree.
Okay, so it's those 4.
Okay.
But I sent an email. I mean,
I understood your email.
Yeah.
But I think some of the other students are a little confused on this, and I.
Okay, yeah, so you just
I didn't.
don't throw them away, because we'll look at them a week from now.
Oh, no,
but not for now. Yeah, it will not be.
Because I think because this information is very detailed and very conceptual in nature, and then to go cold on it on a midterm without having actually an instructor go over it,
right?
Just for us to asynchronously learn it is really a big tall order for us.
Right. No. As I was writing the exam, I realized that, so that's why.
Yes.
I sent that email.
Okay.
Yeah.
It is.
So 37 to 40 are not on the.
Yeah, it is number 37, 38, 39, and 40. And let me see what 41 is. Oh, 41 too. But 42 is included. Yeah. So it's 37 through 41. 1, 2, 3, 4, 5. Yeah.
So I'm sorry, go ahead.
In regards to the 42, I know that this is like the modality. You want us to specifically know that the midbrain is responsible for like those particular cranial nerves.
Yeah. Well, it contains those nuclei, and in particular, we're not going to deal with with these. Do you see is my pointer coming across?
Yes.
Yeah. The visceral motor, except for the dorsal motor nucleus of 10, later on we will deal with that. But these, yes, the branchial motor, yes, those are all involved in speech production. This one, yes, hypoglossal speech production. And general sensory, it's all one real long nucleus, the trigeminal sensory nucleus, which has its 3 parts. And then nucleus solitarius. I don't think certainly on the exam, I don't have anything about the cochlear or vestibular nuclei. I don't.
It's a nucleus solitarius. I thought I was remembering as the accessory nerve. Is that not the thing?
No, that's the nucleus solitarius is associated with the 9th cranial nerve, and it's afferent for your entire pharynx and larynx and everything below it, even down into the esophagus. Not that SLPs get down into the esophagus, but it's a really, really important thing for understanding swallowing, the nucleus solitarius. But I had introduced this particular slide. You've seen it before, I believe, in chapter 1, and you'll see it again. It's kind of important.
Okay.
So I'm trying to get you to start to have some association between the different levels of the brainstem and the different nuclei associated with cranial nerves of interest to SLPs. And I probably do have several questions on the quiz that draw from this, but there's nothing about, I don't have anything about the vestibular or cochlear nuclei. I don't have anything about the Ettinger-Westphal or the salivatory nuclei. And I don't have anything. I might have an abducens nucleus question, maybe. I can't remember. I know I don't have any of these. Okay. Renate had a question about the visual fields, but I'm thinking, in terms of the use of your time at this point, and I'm happy to stay later and answer the visual field question. Do you want to talk about the visual fields, you guys, or do you want to go on to number 2?
Yeah, I really want to do this study, this chapter question.
You should move on. I can figure out.
Okay, let's go to number 2, and then I'd be happy to stay behind and talk about visual fields with anyone who wants to. Okay, so number 2, so now you know what you're going to do. We're going to keep the same groups. You've got a leader, do it in writing and share your screen all along the whole time, so you guys make it very visual. And you're just going to do a list, just like the one we went over. Thank you very much for the group who did it so well. Appreciate that. And let's do this time we're going to go faster. So I'm just going to put us on a 10-minute timer and let's do it. 10 minutes, because I think you've got the idea. You can do it. Okay. Making your groups now. Okay. Breakout rooms. Open all rooms. Here we go.
I'm super sorry. I didn't get put into a breakout.
Okay, we're going to put you in group 3 because group 3 is shrunk. Okay.
Dr. Kitzelman, I think I was kicked out of group 3 because my internet went down
okay.
last time, and so now I'm not in a group.
I'm going to put you in group 3.
Okay, thank you.
Okay.
I can't even find
I didn't put recording on myself, so I don't know where that came from.
It's okay.
Oh, you have it all done.
Yeah, we started it.
Wonderful.
We got ahead of ourselves.
Are you actually all done?
Not the third one.
We haven't done the third one.
But we
You're
did
still
all the ABC. I don't know if you want to like look over.
Awesome. Okay. I might call on you guys.
Oh.
Okay, I'm going to leave you because clearly you're doing great. Okay, bye.
That's definitely not.
Okay.
Yeah. All the bilateral stuff and the decusation, I don't think you need to know.
Okay.
It's like after the internal capsule and the intra or the lenticulostriad artery, and then skip everything until that nuclei thing, and then skip another slide, and then the rest from there. That was super confusing. Hold on one second. I'll just say it. I'll send it.
Professor, the email that you said you sent, it was through the art, like Fullerton emails, right? Or through Canvas?
Through Canvas.
Oh.
Do you not necessarily get those or something?
I do usually. I got some today from another class, but
okay. I mean, I've sent. Do you get any of them that I sent? Because I sent a lot of them. You know, I don't know. I sent like 20 or something like that.
I get them.
Yeah, I get them too.
I get them.
I get them
Okay.
too.
Okay. So did you those of you who are getting them got the one that I'm referring to, you know, where I mentioned the slides that were forget. Okay. I don't know if you're not getting them, do call the help desk and find out what's, you know, if there's something wrong with your email that's not connected to something, or I don't know, something like that.
Okay.
Okay, so yeah, you should be getting them, and it should, you know, there's a subject and everything, I think. Evan, isn't there, when you get those emails, isn't there a subject line?
Yeah, the one you have is the discussion question. Oh, no, it's study questions for class on Wednesday. I'm sorry, this isn't even right.
Yeah, I sent that. No, I think that was probably yesterday I sent that, maybe.
Yeah.
Yeah.
Yeah, the last one was sent on Wednesday. Or, yesterday.
Okay, and the one I think that we're talking about where I said, forget about these slides for the midterm, was probably on Friday or something like that.
It was the 26th, so I think that was Sunday.
Sunday, okay.
And it says, note an exclusion of chapter 3 slides 39 through 43 and text pages 59 through the first part of 60.
Okay.
Yeah, I'll contact the help because
Yeah.
no, I had not gotten any.
Oh wow, yeah, you definitely want to. Yeah, they'll be able to solve that for you, Valerie. I'm not sure what the problem might be. I won't even speculate. I'm not that techie, but they'll figure it out.
Do you have the Canvas app, Valerie?
Yes, I have it on my phone, and I'll get notifications when I get emails from there. And like I have them from every other class, but no, I've never gotten from this class. And I checked my other email as well, like my Fullerton email, and nothing either.
But you're in the class, right?
Yes.
Just thinking about the obvious. You're in the class, you're taking the quizzes.
Yes, exactly.
So yeah, there's some glitch there with your email. I don't know what it would be. Yeah. Okay, so you have the message though as to the slides that we're omitting for the midterm?
Can you repeat the slide numbers, please?
Yeah, from chapter 3, and somebody said 39, I think, but I want to make sure, I just want to double check that and make sure that is correct. Yeah, it's actually more extensive than that. It's 37.
Okay.
Okay, and I'm going to share the screen here. Hang on. Share screen. Okay, here we go. Yes, 37, that's 37, 38, 39, 40, and 41.
Well, thank you so much.
Oh yeah, of course, yeah. So these are, the reason for it is because they're really, really important for SLPs. The concepts are very important for SLPs. And even though it's in the chapter, I realized when I'm starting to write the test, and I did it in the lecture, so it was in there, but I realized when I'm starting to write the text, oh, this is too much. That's just not, we need to spend time on that and not just, you know, that we need to spend more time. So that's why. So next week, you know, a week from tomorrow, we'll take that up.
Okay.
As discussion. I mean, as I said, it is in the lecture for chapter 3, but we'll take it up as far as discussion. I'll make quite a point of it actually, because it's very important.
Okay.
Okay. All right. Are you actually done with number 2?
Yeah, we have it done.
Okay, awesome. Okay, so I'll go to the other rooms real quickly and then come back and we'll come together.
Sounds good. Thanks, Professor.
Sure, bye.
Brachiocephalic artery or the left common carotid?
Wait, where did you get the left common carotid?
Oh wait, so okay. I'm looking at the slide, I think it's slide 27. So it goes from ascending aorta And then if we want to go to the right side of the brain, it branches off into the brachiocephalic artery and then the left common carotid. And so we were going to go to the brachiocephalic, right?
Yeah.
Yeah.
Okay. So then from there.
Which one are you guys on?
We're still on the first one.
A?
Yeah.
Okay. Is somebody doing your list?
I am working on it.
Okay. If you put it out in front of you, and share the screen, might help.
Yeah.
I'm very visual. It helps me anyway.
Yeah, let me just share.
Okay. All right. I'm going to bring you all together pretty soon now.
Okay.
My bell just went off.
Okay.
Okay. Okay, I think we're all back. Could I call on group one? Several of your groups were done with everything, and some of you seem to be done very early. Some of you still working on it, but group one I think was done. So I'm gonna just call on them so they could show us their work and we could kind of see.
I'll share my screen.
Okay, thank you, Jasmine. There you go. Okay, awesome. Number two. Okay, so we're going from the left atrium of the heart. On all of these, we're going from the left atrium of the heart down to, in this case, the right side of the medulla. So you're going from the left atrium to the left ventricle, very good, to the ascending aorta, to the arch of the aorta. Oh, I'm sorry. Are you sharing the screen with everybody? Does everybody see this?
Yeah, we see it.
I can see it.
Okay, but you don't see my cursor, do you?
No.
Okay, so but I'm talking through it. To the arch, to the brachiocephalic. Now we're going to the right. Okay, so the right's good. Your brachiocephalic, you're good. Now here with the common carotid, you've taken a wrong turn. Can anyone in any group help us with that step?
I thought from the brachiocephalic, it goes to the right subclavian.
That's right. It does go to the right.
Right vertebral?
Right vertebral, yeah. Because now the what's called the vertebral basilar system, here's kind of a clue. The vertebral basilar system provides all of the blood to the entire brain stem. What's a brain stem? Medulla, pons, midbrain. All of it. So it can't be the carotid. That's why I can just jump to it that fast. Yeah, so it's the right subclavian, then thank you. And then it's going to be the right vertebral. Yeah, that's it. Then take out the MCA after you get that done. And that's it. You're there.
So we don't need to include the basilar. Is that going too far?
Yes, it is, because the basilar starts
at the pons, right?
Exactly.
At the pons medulla border.
Yeah,
so I was confused by that. I didn't know how far we were supposed to take that.
Yeah, and one of those images then showed the base of the brain, and you could see how the vertebral had little branches going off of it, and the basilar had little branches going off of it to both sides. So you can have a stroke on one side of the pons, or you can have a stroke on one side of the medulla from one of those little branches of them. Yeah, so so
the right vertebral as far as we need to go. Okay.
Yep.
Why are we not using the right common?
No, because that common carotid, the common carotid is going to take us to the internal carotid as far as the brain goes. It's going to take us to the internal carotid. Then the internal carotid is going to go up and divide into the two cerebral arteries that go to, a large part of the cerebrum.
So basically, there are two different systems. One just primarily is giving blood to the brainstem, and the other part is giving brain to like the diencephalon, the upper cerebrum.
Right.
So the vertebral artery is going to give blood to the cerebellum and the brainstem. Is that correct?
Part of the cerebellum and the medulla.
Part of the cerebellum and the medulla.
And then the basilar, which is still part of the vertebral basilar system, to the pons and the cerebellum.
Okay.
Yeah, and then the basilar divides into the two posterior cerebral. So you do get, for the back part of the brain, for the the visual area and everything.
Okay, so that's part of the occipital because it bifurcates into the posterior cerebral. Okay.
Correct. So the entire brainstem gets its blood from the posterior, from the vertebral basilar system, and then the back part, basically, of the cerebrum also gets its blood from the vertebral basilar system. And then they're connected by the circle of Willis. But for most of us with, good arteries, you're not really using the circle of Willis. It's just a fallback protection, like having a fire extinguisher hanging on the wall just in case.
So it's just like a level of redundancy that we have built into our brains.
Okay. Right. Exactly. Okay, so you've got A. Let's look at your B, which we have to get the blood to the right Brodmann's area 17. Okay, now
Professor,
yes.
Sorry, before we move on to the next one, I just wanted to ask about before getting to the medulla. Do we not? We wouldn't include the foramens, right? Like the transverse or the.
Well, you could, but I didn't. I wasn't really thinking that you need to. Yeah, it depends on the level of detail. And if I said, and tell every little foramen that goes through too, but I didn't say that. I just referred to arteries, basically.
Arteries.
Yeah.
Okay, thank you.
You're worrying too much, Valerie. You got to relax.
I think it's the nature of students to worry.
Nature of students, yeah. Especially at 10:30 on Tuesday night before the exam, I think. Okay, so number B. It looks like you have done. There's one problem in it. I'm going to ask if anybody can see the problem, but yeah, mostly you're right here. Yeah, actually, you're very good, very good. But there's one thing in there that doesn't belong. Anyone know from any group?
Would it be the common carotid artery?
Correct. Yeah, that is it. Yeah, just take that out, and I think you've got it.
Because that would be the brachiocephalic, right?
Yeah, you do need a brachiocephalic in there.
Yeah, because they would replace it with that.
Yeah, right after that one, right after arch of the aorta, you need a brachiocephalic, and then the right subclavian, and then the right vertebral, and then the basilar, and then the posterior cerebral artery.
Brachiocephalic, my brain's not functioning anymore.
Brachiocephalic, so it's BRACHIO. Okay, and then it's C. It's one word though, brachiocephalic. So it's O. Take that L out. CEPH. A, LIC, artery. Okay. And then the only other thing that you could do is go back to the second from the last where it says posterior cerebral artery and put in right posterior cerebral artery, since we're trying to be careful about our lateralities. Yep, that's it. That's it, though. You've got a good list. Okay, and then C, the anterior and posterior language zones and the cortical regions in between them of the left cerebral hemisphere. So you've got the left atrium, you've got the left ventricle. There's only one ventricle, though. There's only one left ventricle, so take that S off. Yeah, there you go. Ascending aorta, arch of the aorta. Oh, and left common carotid, very good. So that comes right off the arch, yeah. And then the left internal carotid, and then the MCA and the anterior, yeah, perfect. You could put left MCA, okay. Very good, you got it. Nice, a nice list, and that's a complex one too, but you did very well.
What about the other part that says in the medial cortical regions of the left cerebral hemisphere? Wouldn't that be kind of like another part of the question? That you have to go a different route to get there?
I'm looking at the question.
Yeah, because I have, it has anterior and posterior language zones, and then you have medial cortical regions of the left cerebral hemisphere, which is covered by two different areas.
I mean, you could just put an area in between.
Yeah, because what I did, I kind of broke it down into two questions. I went to from the brachiocephalic, I went to the subclavian to the left vertebral, and then the basilar, and then the left posterior communicating anterior to get to that area. That's why. Am I going too far?
Yeah, but let's go back to the brachiocephalic, because we're on the left now, and there is no brachiocephalic on the left.
Left common carotid. Right?
Yeah, left common carotid. Yeah.
And then that goes to left internal.
That goes to the internal carotid, and then that goes to the left MCA, and then that goes. Basically, here's the deal on that left MCA. It goes to the whole side of the cerebrum. And that includes the anterior, the posterior language zones, and everything in between.
Oh, okay. Because a question, but I'm a little confused by when you mentioned medial cortical regions of the left cerebrum.
Looking.
That's part of the same question.
You mean you're talking about C?
Yes.
I say the anterior and posterior language zones and the cortical regions in between them.
Okay, I guess I'm confused, but I thought maybe it had mentioned medial. Maybe because I said in between, I thought of medial. So that's probably why I probably overdid the question, because
maybe I'm just trying to say, you know, everything, the whole language thing, all of it, and it's right. It's the whole thing there. I'm pointing to the wrong side. I'm pointing
because I was thinking that maybe because that doesn't serve the medial aspects of the hemisphere. That's why I was thinking it had to go another way as well.
Yeah.
So that's sort of how I interpreted
it. It's the whole side of the cerebrum.
Yeah,
lateral. I always refer to it as the lateral convexity.
Okay.
But also the deep areas, as we have talked about.
Okay, but I was thinking of the medial aspect because that's how I interpreted that second part of the question. So that's okay. Everybody thinks of it differently. That's why.
Yeah. Yeah. Okay. Yeah. Okay. So you've done a very, very nice job on that. Okay, let's jump to number 3, and we'll just use yours because you basically it is the CT scan. That's the one that's going to be used for identifying strokes. And we'll get into it later, so don't expect that you're supposed to know this yet, but CT scans will show up a hemorrhage right away, and they will not show up where there's been a blockage and it's caused a different kind of a stroke where there's no hemorrhage, but it's called an infarct. And the CT scan won't show it up for a couple days because actually it takes some time for that tissue to actually die, and then it becomes visible on a CT scan. But you're right. And the EEG is just for measuring the electrophysiology of the brain, and basically that's used to diagnose seizure activity. If somebody has a seizure, they'll always do an EEG. Or if they want to know if their cortex is doing anything, you know, sometimes they study the idea of brain death in somebody by doing an EEG. And I think the other one I used was, yeah, well, and the MRI does the same thing. It does a little better, but it's more expensive. And a lot of hospitals, smaller hospitals, don't have an MRI scanner. But anyway, so you have done it. Why don't we take questions? And Renate, I don't know if you're still there. Are you still there, Renate?
Yes.
You are. Okay, because we'll do the visual field question that you had. We will have to spend 5 or 10 minutes on that probably. Does anyone have a simple question first?
Is that something that's going to be included on the exam? Is that possible?
Is that
just, or is
what
that
chapter was that from?
The visual field? I don't know if I recall that being anything we need to be concerned with. I don't know.
That's actually, isn't that in chapter 5? Am I wrong on that?
Well, I thought it was chapter 3 when we have
It was in chapter 3 at the end.
Brodmann's area 17.
Okay, let me share the screen and look at chapter 3 again.
Oh, I thought it was in Brodmann area 17.
Wow, when we're talking about the Brodmann areas.
So if it was Brodmann area 17, the territory of the posterior cerebral artery. So it takes on the function of the primary and secondary zones of the visual cortex, BA 17, 18, and 19. And if we had an infarct or a stroke in that area, it would cause the primary field visual loss.
Hang on, I'm just trying to figure out the visual fields here.
Yeah,
we don't have, we do go into it quite a bit, but I think it's in chapter 5. So the only thing I've said about that is relevant, and it could be on the test, is that your visual fields project to the opposite Brodmann's area 17. But we didn't go into much detail.
Okay.
Yeah, that was it basically. If you when you look out at a focal point, everything on the right side is projecting to your left BA 17. And so if you did lose your left BA 17, you'd lose your right visual field. So I'm not sure that I have anything on the quiz about the laterality of that. I do have some things about the Brodmann's area 17, to know that is where vision projects to Brodmann's area 17 for sure. But if I have anything about laterality, it's kind of simple. Right goes to left, left goes to right. And then, but we in the next chapter 5, we do go into quite a bit of detail on that.
Because I think Renate's question is a good question. I just think it may be just the level of detail is not what we learned yet. So.
Well, yeah, we just haven't gotten there yet. What we do in chapter 5. Yeah. And we'll look at it in quite a lot of depth. Because for SLPs, it's pretty important because you'll have a lot of people, trust me, who have trouble with that. And you have to compensate for it in not only in their reading and writing activities, but in every kind of anything that's visually based. Like if you just show them an object and say, what is this? And they can only see half of it. And there's a subgroup of people who don't seem to grasp that there is another half, if that makes sense. Yeah. They have what's called a neglect. And so it doesn't sink into their consciousness that there would be another half that they don't see. Like, we all have an edge to our visual field. Like my visual field ends about here. I'm wiggling my hands out here, but I can't see my hands wiggling right out here. But if I bring them up here, I can see them, of course. But if I bring them out here, I can't. But I know that there's stuff back here, but there's a group of patients who don't. If they don't see it, it doesn't exist. Yeah, okay. Any other questions before we jump in our jammies?
Well, thank you for your time, Professor. This is very, very, very kind that you've done this for us. I think it really has helped.
Y'all done with everything then?
I know how to do it now.
Are you gonna post the recording right away?
I'll post it in the morning.
Okay, so 6 o'clock in the morning, it'll be there.
We'll get about 2 hours of sleep and go for it again.
That's what I'm gonna do. I'm gonna wake up
That's
at
when I'm going to bed, Jordy.
What time did you say?
6 o'clock in the morning. They'll be there, right?
I don't think about the 6. I'm up at 5:30, but I'm not actually.
I got you all beat.
What time do you get up?
You don't want to know. I get up early.
Oh, earlier than 5:30?
Yes.
Oh, I was impressed with myself, and now I'm not.
There's something I have I'm very consistent. When I if I go over in college, I start walking around the whole perimeter of the college around 5:30 in the morning.
Oh, that's wonderful.
That's my thing. That's how I calm myself every day.
Yeah. I love early mornings, really.
Yeah, I do too.
Yeah, there's just something about it. And to go out, when you go out driving down to get coffee or whatever you do, or walking around the campus, and there's nobody on the street, it's kind of cool.
I wish